Hi, and welcome to today's video. I'm Dr. Erik Lough in Capital Surgeons Group and Southwest Bariatric Surgeons in Austin, Texas. I specialize in hiatal hernia, gastroesophageal reflux, and weight loss surgery. I answer common questions that patients ask me about general and weight loss surgery, and in today's video, I answer the question, what is gastric bypass? Gastric bypass is the most common name for a Roux-en-Y gastric bypass, one of the original weight loss surgeries. It has been performed for over 50 years, and it has been refined to the laparoscopic approach back in the early 90s. Today, it has been further refined to the way that I perform it, which is robotic gastric bypass. I already made a video about what is gastric sleeve, and today I'll explain how gastric bypass is different from gastric sleeve. Once a patient is asleep under general anesthesia, I make several small incisions on the abdomen. I put my camera through one incision and my working instruments through the other incisions. Using a surgical stapler, I make a small gastric pouch out of the upper part of the stomach. This also separates the gastric pouch from the larger remaining part of the stomach. Unlike the gastric sleeve, where the food exits through the natural exit of the stomach, the small gastric pouch does not have an exit, so I have to give it an exit. I bring a part of the small intestine up to the gastric pouch, and I sew a new connection there with needle and suture. So when food comes into the gastric pouch, it crosses through that new connection directly into the intestine. The food will no longer pass through that larger remaining part of the stomach, in other words, bypassing it. But this part of the stomach is still alive, and it will continue making digestive juices. And these digestive juices have to go somewhere, along with the bile from the liver and digestive enzymes from the pancreas. So I make a second connection back to the intestine further downstream, allowing the juices to mix with the food from above. Digestion of food proceeds onward from this point as usual. When you eat, food will come into the small gastric pouch, making you feel full with a very small amount of food. And you also feel satisfied by that small amount. And this reduces your total intake of food. Because food is not mixing with the digestive juices until later, it won't be digested and absorbed as well. So this reduces your overall absorption of the food that you do eat. Therefore, you will also lose weight because of reduced absorption. Also, because that other part of the stomach is being bypassed, hormones change, and metabolic problems like diabetes can be resolved almost immediately, like seriously within a week after surgery. If a patient is morbidly obese and has been battling diabetes for a long time, then a bypass is a way better option for you compared to a gastric sleeve. Bypass is also way better for stopping acid reflux than gastric sleeve. Surgery takes about 2 hours, and I send many of my patients home the same day. My average patient starts out with a BMI in the 50s, and over the course of a year can lose down to a BMI into the high 20s or even low 30s. And my average bypass patient usually has something else going on like diabetes or acid reflux, and that resolves as well. So, what is gastric bypass? It is a laparoscopic or robotic weight loss surgery that reduces how much a person can eat and absorb, creating lifelong, significant weight loss and metabolism improvement.